What is anorexia nervosa? Anorexia nervosa is a serious eating disorder characterized by an intense fear of gaining weight, a distorted body image, and severe restriction of food intake. It often leads to significant weight loss and a variety of physical and mental health complications. Despite being underweight, individuals with anorexia typically perceive themselves as overweight and are preoccupied with controlling their body size. Types of anorexia nervosa. 1. Restrictive type. Individuals severely limit calorie intake by dieting, fasting, or excessive exercise. 2. Binge purge type. Involves episodes of binge eating followed by purging behaviors, such as self-induced vomiting or misuse of laxatives, diuretics, or enemas. Causes. The exact cause is unknown, but anorexia is believed to result from a combination of factors. Biological, genetic predisposition, hormonal imbalances, or brain chemistry affecting mood and hunger regulation. Psychological, low self-esteem, perfectionism, and obsessive tendencies. Social and cultural, societal pressure to be thin, exposure to unrealistic beauty standards, and a culture that values thinness. Environmental, traumatic experiences, stressful life events, or family dynamics. Symptoms. Physical. Extreme weight loss, fatigue, weakness and fainting, dry skin, brittle nails, and hair thinning. Amenorrhea, absence of menstruation in women. Cold intolerance, frequently feeling cold. Lanugo, fine hair growth on the body to conserve heat. Constipation and abdominal pain. Psychological, distorted body image, seeing oneself as overweight despite being underweight. Obsession with dieting, calories, and exercise. Intense fear of gaining weight. Social withdrawal and isolation. Behavioral. Refusal to eat or eating only very small portions. Avoidance of certain foods or food groups. Ritualistic eating habits, e.g., cutting food into tiny pieces, eating very slowly. Excessive exercise beyond what is healthy or safe. Diagnosis. Diagnosis is typically made based on 1. Medical history and physical exam, assessment of weight, height, and symptoms. 2. Psychological evaluation, examining thoughts, behaviors, and feelings related to food and body image. 3. Diagnostic criteria, DSM-5, restriction of energy intake leading to significantly low body weight. Intense fear of gaining weight or becoming fat. Distorted perception of body weight or shape. Treatment. Treatment involves a multidisciplinary approach, often combining medical care, psychological therapy, and nutritional counseling. 1. Medical intervention. Stabilize physical health, especially if the individual is severely malnourished. Address complications like electrolyte imbalances, heart issues, or bone density loss. 2. Therapy. Cognitive behavioral therapy, CBT, helps change unhealthy thought patterns related to food and body image. Family-based therapy, FBT, especially effective for adolescents, involving family support and recovery. Individual therapy, focuses on emotional regulation and coping mechanisms. 3. Nutritional support. Work with a dietitian to create a healthy, balanced meal plan. Gradual reintroduction of food to avoid refeeding syndrome, a dangerous condition that can occur when nourishment is reintroduced too quickly. 4. Medication. While no medication directly treats anorexia, antidepressants or anti-anxiety medications may help manage underlying mental health issues. Complications. If untreated, anorexia can lead to severe and potentially life-threatening complications, such as cardiovascular issues, e.g., bradycardia, arrhythmias, osteoporosis and fractures due to low bone density, infertility and hormonal imbalances, organ failure, severe malnutrition, increased risk of suicide. Recovery and prognosis. Recovery is possible, but it can be a long process requiring consistent support and therapy. Early intervention increases the chances of full recovery. Relapses are common, so ongoing care and monitoring are crucial. Prevention. Promote a positive body image and healthy attitudes toward food. Educate about the dangers of dieting and extreme weight loss. Encourage open communication about emotions and self-esteem. Anorexia nervosa is a complex condition that requires compassion, patience, and professional care to address both the physical and psychological aspects of the disorder.